On today's podcast,
all of these men are having fertility issues, but they just keep moving the normal range down. So it used to be just 20 million not that long ago. Now it's 15. But if you look back in just the last mid-century, almost all men today would be considered infertile back then. So the levels are just drastically declining.
if you're a healthcare provider tired of just treating symptoms and ready to dig deeper into the root causes of health issues, the Vibrant Wellness Podcast is for you. With insider tips, expert interviews, and the latest in biotech research, this podcast will take your patient care to the next level. Welcome to the Vibrant Wellness Podcast. I am your co-host, Jen Rivas, along with the one and only Dr. Emmy Brown. Hi, Dr. Emmy.
Hey, Jen. How's it going?
I'm doing great, and I'm excited for our episode today
Me
because
too.
I know you are. We've been talking a lot about it. We have a very special guest joining us. It is Dr. Leah Gordon. Dr. Leah is a licensed naturopathic and functional medicine doctor specializing in supporting women on their journey to motherhood. So while her online platform, Womanhood Wellness, she empowers women to break up with birth control, balance their hormones, prepare for pregnancy, conceive naturally, or navigate infertility. Dr. Leah's personal experiences with hormonal struggles and her challenging journey of male factor infertility have shaped her passion, and it is the topic that we're going to dive deep into today. We'll discuss how societal or cultural biases have perpetuated the weight of fertility concerns, primarily on women, and the role our male partners play in that. She's a founding formulator at Needed, one of the top women's health, fertility, and motherhood-focused supplement lines. And she's also a co-host of her very own podcast called Healthy as a Mother. She also is a medical contributor to Motherly. So with all of that said, buckle up as we get ready to unlock the secrets of natural fertility and hormone support with Dr. Leah. Welcome to the podcast.
Thank you. Oh my gosh, that was a mouthful. Thanks for reading all of that. And I'm so excited for being here and to talk about what we're talking about today.
Yes. So happy to have you, Dr. Leah. And I'm going to kick it off. I'd love to learn more about your personal journey. But before we do that, I always love to know how my fellow naturopathic doctors got into naturopathic medicine versus conventional medicine. What made you choose to decide to go to naturopathic medical school?
Yeah, I actually had a unique situation. When I was a young person, we had a work opportunity in middle school where we could go work somewhere in the community. And the place that I worked at was a alternative spinal rehab clinic. So we were sort of the alternative to spinal surgery. It was a specialized form of chiropractic where they used traction therapy to basically put the curvature back into spines that, if their neck was straight or they had a car accident or something like that. And so I learned at a really early age this sort of alternative way of looking at the body. We learned about nutrition and the power of our mindset and health. And the doctors that worked there were who introduced me to naturopathic medicine. And when they told me about it, I was like, this is my dream profession. And I loved working with the patients in that clinic. I wasn't as drawn as much to the physical medicine aspect. I loved hearing people's stories. I loved the nutrition component, and I loved just physiology in general, understanding how the body worked and how things work together. And so I knew I wanted to be a doctor of some sort. And when I heard about naturopathic medicine, I was like, this is my calling, even though everyone along my path told me I was crazy and I needed to become a quote unquote real doctor and all of the things that people come up against. And I'm so happy that I followed my passion. And my passion within naturopathic medicine really was shaped by my own personal health journey. But it's so funny now, I go back to the same small town that I'm from, and now I'm like a celebrity because I'm a naturopathic doctor. And it's just funny to see how, 15, 20 years have changed people's idea of what people want in their world and in their health. And so I'm so glad that I made the decision. I love being a naturopathic doctor.
Same. Yeah. The road less traveled. Where are you from?
I'm from a small town called Windsor in Colorado. It's not so small anymore. It was much smaller when I grew up there, but it's just east of Fort Collins, which is north of Denver, about an hour.
Oh, got it. Okay. In Colorado, they have licensure for NDs. So that helps. Just want to throw that out there. And I've experienced that too. Depending on where you're talking to people around the country, they get really excited about what we do. And people are just way more interested in health and wellness now, thankfully. So,
yeah. And social media has definitely helped with that.
And so you mentioned your own journey. I know you do a lot of women's health. You're a women's health expert. So do you mind telling us a little bit about your fertility journey?
Yeah. So I do focus a lot on women. My company, Womanhood Wellness, is that. And in fertility, for us at least, our biggest factor was male factor infertility. We were not able to conceive naturally. So I found out about my husband's sperm when I was in naturopathic medical school. We were in our sperm analysis class, evaluating sperm, learning how to look at it under the microscope, and we needed a sample. And I brought in my husband's and discovered that he had no sperm. And it was really emotional and one of the worst days of my entire life to break the news to him. I mean, it's one of those impactful moments that you remember the smell, you remember everything that was around you, because it was just so emotional. We hadn't started trying at that point. So our infertility journey was sort of unique and backwards, where we knew of a problem before we had even started trying. And then we went down the whole path of like, why do you not have sperm, and what's going on, and how can we support you? And I was still a student, so I had so much to learn. And one of the things I learned was a lot of the professionals in the world aren't actually that helpful, unfortunately. And so we were tossed around from doctor to doctor and had lots of issues trying to figure out what was going on. And being a naturopathic doctor, initially I refused to believe that there wasn't a root cause. Like, why does he just not have sperm? I needed to know, root cause medicine is a big part of my practice. And, went down multiple avenues of trying to figure it out. And so through that journey of many years, it was almost 6 years until we discovered that there really was no option for us other than IVF, given my husband's situation and some things that came to light toward the end of that journey. So then we went down the IVF path, which I also learned a lot being a root cause naturopathic doctor, going through that process, how flawed it is and how much help they could receive from our side of the situation of fertility support. And so I just have a lot of knowledge on male factor infertility and women's health together. There's just a huge umbrella of things. I was in practice seeing patients focusing on women's health primarily, while secretly keeping to myself. Really, a lot of people didn't know about our infertility journey, navigating male factor infertility. And once we finally conceived, I came out, into the public eye with what we've been dealing with. And now I've just had a slew of people that are struggling with the same things. And I feel blessed for our journey now that I can help people, but it was definitely hard when we were going through it and are still going through it. I mean, we want more children, and we still have to go through the process of IVF to have more children, which is sad and sucky in some ways. And also I'm so grateful for it. And a lot of times I think there's many things that we can do where IVF doesn't need to be the route that people go. And that's why I love talking about male factor.
Yeah, you've learned so much and you continue to learn. And so that's so valuable for everybody who wants to conceive, and especially this portion of the conversation, the male factor infertility. So I'm wondering, and as you continue to learn, what do you wish you knew back then that you know now? Or what kind of advice would you give couples who are trying to conceive that you've learned along the way?
Yeah, there's so much to unpack there. I wish that I had had sort of what I'm creating for people, which is this kind of step-by-step guide of what is going on, what part of male factor infertility indicates that it's more lifestyle, and what part indicates that there's something more serious going on. What levels of sperm counts and severity of sperm markers say, oh no, this is something that like you need to be checking, primarily genetics, like, obviously still optimizing in lifestyle, versus where is there maybe toxin exposure playing a role, or where is there, any sort of underlying root cause factor. Because for us, just in our journey, I wasn't really guided in a proper educated way on the severity of my husband's sperm issue being something that was probably impossible for us to correct through diet and lifestyle. However, one of the biggest things that I want to like scream from the top of my lungs is that whether you conceive naturally or if you have to go through assisted reproduction like IUI or IVF, you still need to optimize your partner's sperm. And this is a huge thing that is being left out of the fertility conversation across the board. So most couples who are struggling to conceive for a year, there's hardly any workup done on them. Almost no men get sperm analyses done within that year. And as soon as it's been a year, they're kind of just shuttled into IVF. And no approach of either trying to figure out what's going on with them to begin with, or any optimization of either partner is really done as they're shuttled into IVF. And what happens is a woman might go forward with egg quality issues and a man with sperm quality issues. And yes, even though you're doing IVF and getting around certain obstacles, the quality of the DNA of the egg and sperm are what will dictate the health of the embryo and will dictate your ability to have it transfer and have a successful pregnancy and then have healthy children in the future. And time again along our journey, we were told by doctors, oh, his sperm doesn't matter. We're doing ICSI, which is a procedure where they like take the sperm with tweezers essentially and stick it into the egg. And we actually had to do a retrieval of his sperm from his testicles surgically, which is not typical with IVF. It was just that severe. But they would just tell me, and my patients are told the same thing, sperm don't matter, now that we're doing IVF. And I couldn't disagree more. They absolutely matter. Mm-hmm. And so if I could just like scream to anybody, like whether you have a man who has, the very first thing that I just think people need to do is check their partner's sperm, because if it's good, that's great. And it gives you peace of mind. And if it's not, which more and more likely it is becoming, very common that it's not, there's time to work on it, and or you can identify issues. And even if you have to go through reproductive help, we still want to optimize sperm. So there's no way of getting out of optimizing sperm, in my opinion, when it comes to the fertility conversation. And that's something that I learned along our journey, to circle back to that question, was even though my husband's fertility thing was so severe that we had to do like the most extreme thing to have our child, I believe to the core of my being that we have the healthy embryos and the healthy children that we do because we optimized his diet and his lifestyle, and we got the toxins out of his body, and we worked on his mitochondria, and we did all of those things because the little DNA integrity of the sperm they were able to retrieve, and even in such an extreme situation, those were healthy. And that's the one thing I just really want people to move forward with, that it is always important that we work on the man's health.
Such great advice. Yeah.
Absolutely. It cannot be said enough, and it's empowering, right? Mm-hmm. And people don't know what they don't know. So if we can put the message out there that there's so much we can do in terms of diet, lifestyle, checking for toxicity and addressing that, it's just immensely powerful. So thank you for explaining that. And I want to get into more specifics of the testing for sperm quality and count. But before we do that, I really want to zoom out and think about, why is the primary focus and pressure so much on women for fertility? And why is the male component so often ignored?
This is, in my opinion, multifactorial. And I'll speak to some of the pieces that I've come to understand, and I'm probably missing many of them, so you guys can chime in. But in my experience, from what I've seen, just working with patients and being myself in the system and such, is one, I think there are still, it is very, the medical system is like a giant boulder. And whenever we need to shift or pivot, it is a lot harder to move a really heavy giant boulder than it is to move a light ping pong ball. And, people talk about this in relation to corporations versus startups. Like, startups can pivot really fast because they're smaller, and they can just make shifts and changes quickly versus a giant corporation. And our medical system is so ginormous and so giant, and it takes so much effort and pressure to make any sort of change inside that system. And although it seems like a long time ago, the middle of the last century, when the medical system was primarily male dominated and women's pregnancies and birth were sort of a disease handled by these, male doctors, that kind of thought process hasn't shifted or changed that much. And I think that's part of it where, very few, even back in the day, my husband's grandparents struggled with fertility, and who knows who it was. The blame was always put on her. But I've asked questions, and they never tested him. And, all of these things, I think just back then, it's it would never be the man's, role. So I think there's part of that. I think part of it is that women carry babies. And so once a woman becomes pregnant, it's very focused on her. And she's the pregnant one who is growing the baby. She births the baby. She nurses the baby. So a lot of the energy and attention around birth and motherhood is around the mother. And so I think that people forget the role that the man plays in creating the baby in the first place. And I think it's just a part of the culture to just think pregnancy, babies, women. I think another aspect is that women have this inherent drive. I'm speaking in generalities in a heterosexual relationship, but in general, women have a little bit more of this maternal instinct drive to want to start a family and are maybe the one who's going to be researching on the internet to find, how to support themselves. Or if they're not getting pregnant, they might have more distress over that than maybe the male partner. I don't have a lot of men coming to me individually by themselves stressing out because they can't get pregnant. It's usually the woman who is stressing out and then brings her partner with her. Even if the man cares, it's still typically headed by the woman. So they're the ones going to the doctor. So they're the ones that are being tested and kind of focused on. And then there's a lot of shame around fertility struggles with men. And it's a cultural thing. Again, I think that we don't talk enough about the role of men. I mean, I even had a patient the other day who I saw her husband's sperm analysis, and he said he was told by a fertility doctor it was fine, and it's not fine. And first of all, I'm mad that the doctor said that because it's not fine. And it took him so long to even accept the fact that there might be an issue with him because it would hurt his pride or it would hurt, all of the different things, that he wouldn't even accept the fact that his sperm was off. So how would he make any shifts or changes? And this poor woman, is trying everything she can in her power, yet, he's just not playing an active role. And that's not always the case. I have couples that are very committed, both of them. But in general, it's just not part of our medical system. Even now and through the IVF space, couples are told the sperm doesn't really matter if you're going through IVF. Where does that come from? They're not reading their own literature. It doesn't make any sense. So I think there's just a lot of cultural and medical indoctrination ideals passed down. And if you question that, you're kind of looked at funny in that world. So there's a lot to unpack with that. But yeah, many reasons.
And those are the high points. And I think really thinking about there's a gap of time between what we're seeing in the literature and when it reaches our medical curriculum. So, and we see that so often in functional medicine and naturopathic medicine and lifestyle medicine, so on and so forth. But I think that's a big point to, really advocate for yourself, look at the literature. And also, I think, as you kind of alluded to, Dr. Leah, the female is the one who gets pregnant, but we're also seeing signs and maybe issues with irregular periods, maybe severe PMS, a lifetime of hormonal issues. Hashimoto's has a higher incidence in women. So I just want to throw those out there too, that those could be some issues and why we're not really looking at the male factor in fertility, because unless you're really looking at the sperm, like you said, and we can't stress how important that is enough, how would you know? And that's actually, I was going to ask later, but since we're here now, I'm going to jump ahead, Jen. So, and then we can circle back, Jen, because I know you have some questions before I was going to jump into this originally, but
no worries,
because it can be more obvious in females in terms of missed periods, as we said, we do see more Hashimoto's in females. What kinds of clinical signs or symptoms do you see in males? And of course, erectile dysfunction could be a sign, but anything else that you see, Dr. Leah, that might indicate suboptimal fertility?
Yeah, no, you bring up a great point. I'm glad that you did, because yes, I would say women, have a monthly pulse on their hormones with their periods and everything, and men just don't have that as much. So women have a monthly hormonal rhythm that ends in a period. Men have a daily hormonal rhythm. So typically, testosterone is the main hormone that makes sperm in men. And testosterone resets every day. So like a woman's hormones kind of reset every month, a man's resets every day. A sign of a good amount of testosterone in a man is actually that he wakes up with an erection. It's not required, but that's one thing I do ask my patients of, do you wake up with morning erection? And if they say, no, I used to when I was a teenager, but I don't anymore, that's a big sign for me that like maybe we want to check their testosterone. If they have low energy, so testosterone is also an energy producing hormone as well as a drive. So when men have sort of this lack of drive for life, I don't really feel motivated to go do anything. I don't really want to get up off the couch. I don't want to go exercise. Like they go to work, they do the bare minimum, come home, lay on the couch and veg. That can be a sign of low testosterone because testosterone gives you a drive, a low libido. A lot of men struggle with low libido, believe it or not. And so if you are a female with low libido, you might not realize that your partner has low libido because you're both comfortably content not having sex. But if you just ask that question, it's normal, I would say, for a man to want to have sex, a few times a week. It doesn't mean you guys end up having sex a few times a week, but asking him like, do you have the drive to want to have sex with me? Because if he doesn't, that's another sign. If he has a very stressful life, like in general, he works very long hours, maybe he works night shifts. If just he seems really stressed all the time, or like I said, he comes home and just needs to veg because he's so burned out that he has to just kind of like zone everything out and like not do much. That's a sign of adrenal fatigue, which can affect testosterone. If he has like gynecomastia, which is breast tissue, so if not pecs, like he's been working out and has pecs, but maybe breast development in a man can be a sign of higher prolactin and estrogen. So there's a bunch of different things, but I would say the classic thing would be energy and libido that men find. And then yes, erectile dysfunction. If you are engaging in intimacy and can't get an erection at all, that can definitely be a sign that there's a testosterone issue, although it can be mental, emotional as well. So all of these are signs to get your hormones checked and to get your sperm checked, in my opinion. I think all men should have their sperm checked just like we check cholesterol. I think it's a sign of health in a man, whether a man ever wants children or not.
Hallelujah.
Yeah, that's right. Let's even the scales a little bit, right? With with crossing the T's and dotting the I's.
Yeah.
I'm curious, Dr. Leah, when working with, and again, I'm assuming most women are coming to you. Is it almost a prerequisite for you in working with your clients that you bring, if assuming they have a partner, obviously, that you bring the partner on board and you have these conversations, which I'm sure not all are easy?
Yeah. So I should probably make it a requirement. I've never made it a 100% requirement in the past. However, it does make it more challenging when the male partner isn't present, even though when you get into fertility, especially, in the preconception period of just making sure everyone's good, that's quite easy to check, certain labs on each partner, making sure everything's good to go is like a preparation for pregnancy. However, if you are struggling, especially with unexplained infertility, it's treating two uniquely different people. So I have done appointments where I have both couples and we kind of try to do both at the same time. And that can be really intense because then you realize, oh, the female is like their own thing that requires a lot of investigation as to what's going on with her. And then the male is his own thing requiring a lot of investigation with him. And so sometimes people see the man as just like an add-on. Like, I'm just going to bring my husband and like, he's just like a little add-on. Like, just tell me what supplements to take. And, that can be, I'd rather you take something and support in whatever capacity you're willing to give. But to really be the most effective in situations, you sort of need to treat each partner as an individual. In my couples that I've worked with where the man isn't present or he's like resistant to changes or shifts, it's definitely more challenging and I can't force them to come. But I have the conversation, that his role is just as important and he needs to play an active role. And sometimes I'm counseling my patients on how to use motivational interviewing with their own partner of what motivates him, because not every man is motivated by having children. I mean, it sounds bizarre, but like not all of them are. They might be doing it because their wife wants kids, but they're like kind of indifferent. And it's just, there's a lot of things that can come up with all of that. Some men might be more motivated about being alive longer to be with their children. They might be like, my sperm's good enough, but it's like, but what about your cardiovascular health? Because all of these factors that are imbalanced, that are showing issues that are affecting your sperm, are also affecting your heart. They're also affecting a lot of other factors. And then some men are more motivated by actually like having a libido or feeling good and having energy. So sometimes you sort of have to bring in different components. They're maybe not always as motivated to just want lots of children, but some men are. So yeah, that was like a long question to your answer to your question.
No, that was great. And you're so right. And we've talked with several providers. It seems like a lot of times your role is also part counselor, right? Because it's just it's a lot of listening, a lot of intake, and you've dealt with so many now that I love how you're sort of, in a way, you're pulling out their why, what motivates them, why, what would get them excited enough to actually partake and participate in that. So yeah, no, that's great.
I was just going to echo what Jen said. It's the why, and I have used it in practice myself. How can we frame it for this individual to motivate them? And I love that, because everybody's why is different. And I love how you pulled in the holistic nature of it. What about your heart health? What about these other things that are going on that are impacting your fertility? Because it's all related. So finding that, or exercise and endurance, and if somebody's an athlete, that's just coming to mind. Well, if you want to stay healthy in the gym, well, we also want to look at how this is maybe impacting your fertility. If you are having trouble with, whatever, hypertension or prediabetes, and it's all related. I just wanted to throw that out there because that's such a great connection there.
Yeah, love that.
All right, so then let's dive into a little bit more in detail. How do we really assess our male fertility? And so I was listening to your podcast, Dr. Leah, and you mentioned that in the book, The Countdown, the author cites that it is projected that there will be no fertile males by year 2045. Did I get that right?
Yeah, I know. It's a really depressing statistic. And, The Countdown is a wonderful book for anyone who hasn't read it, written by the epidemiologist and researcher who's really studying the effect of toxins on sperm. And, a lot of people will give flack for that study. And the way that they came up with that was just looking at the trajectory of the last few years. And if that trajectory continues and doesn't slow down, that is the rate of how fast fertility is declining, especially in males. And so, yeah, it's alarming, and why more people aren't talking about it, I don't know. I mean, again, I could extrapolate into lots of different reasons, but it's important. This is important, and I think it should be at the top of our public health conversations and the top of, all sorts of conversations. And unfortunately, it's not.
Right. So yeah, we really need to change our trajectory. That's really the theme here. So I'm wondering, what are a few of the most impactful lifestyle risk factors for male factor infertility in your book?
Yeah, there's quite a few. And the challenging part with fertility is oftentimes when a person has been trying to conceive and then realizes that they're struggling with infertility, there's not a ton of time that they want to give themselves. People are like, they want to be pregnant right now. And for men and women, but especially men, a lot of it are lifestyle and dietary factors. And so to impact and change the sperm, it requires changes to someone's life. And that can be hard to hear for some men. So some top things are in the dietary realm. Processed meats, so the hot dogs, the processed meats that come in packages and bags and aren't the traditional just clean sources of animal protein. Processed foods in general, trans fats in particular. So trans fats are the types of fats that are often put in foods to help them be shelf stable, so that they don't go bad. Things like, think grocery or a gas station. If you go to the gas station, all the food in the gas station is most likely going to have trans fats and other unhealthy things. Alcohol is another one that greatly impacts male fertility. Sugar, as well can impact male fertility from a lifestyle in general, just unhealthy fats. So omega-3 fats are healthy fats that we find in cold water fish like salmon, sardines, anchovies. And those are very, very helpful for sperm. However, the more inflammatory fats like the seed oils, arachidonic acid, and corn-fed beef and things like that can be really harmful for sperm. So at the end of the day, from a dietary perspective, it's eating whole foods, eating lots of antioxidants, things like colorful fruits and vegetables. And it's just depending on your partner's diet, it can be really shocking just to hear that alone. Reducing soda, reducing, all of these things that maybe are in their life. Like, again, a couple that I had the other day, he just drinks energy drinks. He is a trucker, so he's always eating stuff at gas stations, sitting for long hours. So that brings up heat. Unfortunately, whoever designed us designed the testicles to be outside of the body because sperm can't be hot. And I don't know why we were designed that way, but they can't be hot, or the ways they are harmed. So if you're in hot tubs, saunas, sitting excessively, whether that's at a desk job or in a car, if you have really tight boxers, if you are having your laptop on your lap, these things can cause damage to sperm. That's typically an easier one to fix, getting stand-up desks, moving more. Sedentary lifestyle, people who aren't exercising or moving can impact sperm. Toxins to me are the reason why the trajectory of sperm decline has been so rapid in the last few years, because it's really that in our food system for sure. But I kind of lump certain food in with toxins. But when I talk about toxins, it's herbicides, pesticides in our food. And it's also the chemicals that are in our products, like our shampoos, our conditioners, our body soaps, our hand washes, our cleaning products. They are endocrine disruptors, which means that they impact our hormones. And in particular, a lot of our personal care products contain what are called phthalates. Phthalates are often the thing that is in products that have a scent or a fragrance. It's what keeps them sticking around. If you go into an elevator and someone has perfume on and you leave the elevator and you still smell like their perfume, that's because of phthalates. Phthalates are anti-androgenic. Androgens are testosterone, is an androgen. And testosterone is the hormone that makes sperm. So all of our boys, since they were babies, have been exposed to phthalates from their moms in utero all the way in their childhood, their teenage years, their adult years, and now are trying to have children, yet their development in utero back 30 plus years ago, and now they're doused in an environment that is literally lowering testosterone and killing sperm. So it's not rocket science why it's happening. And the fact that, more steps aren't being taken to protect us from these toxins, it blows my mind a lot actually. And so I would say toxins in my experience are probably one of the biggest factors, and a factor that even the conventional fertility world is ignoring, which is a shame.
Yeah. I love how you're sharing these practical steps that people can take. I'm curious, Dr. Leah, is there any surprising or maybe lesser known influences to consider? Maybe something surprising you've even seen in working with clients?
Marijuana is one. So there's some interesting marijuana and vaping. I think a lot of people think they're better than cigarettes. Like, cigarettes definitely impact sperm, and I think people don't really realize the impact of that. So vaping for sure has been found to impact sperm. And then anything that's oxidized, if you smoke anything, including marijuana, we are seeing impacts of that, which is unfortunate because, pro or con marijuana, whatever, it's legal in a lot of states now. And so it's definitely more common practice. Some other things that impact, gosh, there's so many things. I'm trying to think off the top of my head.
I was just going to ask, I know that edibles, have become so prevalent, and I'm naive in asking this, but does that have the same effect as actually smoking it?
It's a good question. And there isn't a ton of research yet deciphering between the two to say confidently one way or another. A lot of the studies that have looked at it are in inhaled marijuana. So it's hard to tease apart. Is it the actual oxidation from the smoke, from burning it, which we know causes oxidative damage, which damages sperm, or is it the marijuana itself? Like I said, now that marijuana is legal in a lot of places, those studies can probably be done, and it's really quite easy to study sperm. So I haven't looked recently at the literature on that, but my assumption and guess would be that it's not going to be as impactful from an edible as it would be from smoking, because I think it's the oxidation itself that causes those issues.
Mhm.
Cigarettes has oxidation from burning, but also a lot of chemicals and toxins like nicotine and all of the other stuff that they put in cigarettes, that basically anything that breaks down DNA affects sperm. Anything that causes cancer, think it also affects sperm, because both mechanisms are usually a breakdown of DNA integrity. And sperm are just very fragile and very sensitive. And so they're sensitive to all of those things. Some other things that aren't surprising and are sort of vanilla but very important are sleep. A lot of men don't realize that it's during sleep that you make growth hormone, and that helps boost testosterone. I have a lot of male patients who are like, I can run on 5 hours of sleep. And even the ones who are quote unquote healthy are excessive exercisers. They get up at the butt crack of dawn, they go cycle in their tight little shorts, and then they go sauna to try to get the toxins out, which is great. And they work all day, not eating well, intermittent fasting. So they skip eating most of the day, probably not drinking a lot of water. And then they're exhausted by the end of the day. So they stay up late watching, stressful shows, and then they don't sleep a lot. This is a very classic, even like quote unquote healthy pattern of, high achieving men. And that can really impact your sperm on multiple levels, because you really need to sleep to make testosterone, to make sperm. And stress is a huge killer. And so even though you might feel fine, this is again what you alluded to, Dr. Emmy, about how men don't necessarily have obvious signs, and why I think checking sperm, regardless of whatever lifestyle you have, is very important. And even like in my husband's case, he's very healthy. We are very healthy people. I would have had no idea. And our infertility journey would have been even longer if we had waited to start trying, then had a year of trying before we ever even found out about his sperm, and then went through all the things we tried to do. So I just can't emphasize enough how much checking sperm early on is important.
Yeah. It's that preventative measure. Thank you for sharing that. So we talked about a lot of lifestyle factors, most of which we can control. Might not be easy, but we can control. I'm curious about the genetic predisposition. How does that play a role with male infertility?
Yeah, so there's a lot of different genetics involved with male fertility. If you go to a traditional fertility doctor, they typically do run the traditional genetic panels, such as karyotyping, to make sure, some people are born with different types of chromosomes. A woman is XX, a man is XY. Sometimes men are born XXY. Sometimes people have issues with translocation of different chromosomes. So checking those kind of things are important. There's also other genetic components, like cystic fibrosis is a genetic condition where it can greatly impact sperm. Now, typically a person knows if they have cystic fibrosis because it affects their lungs. It's a recessive disorder, meaning you have to have both parents have it to have the full expression of the disease. However, in my husband's situation, we found this out way after all of our workup, years and years later, that he had one recessive mutation, not two. So he never had the full-blown disease, but there is an associated disorders of cystic fibrosis, which can cause a developmental issue of the vas deferens, which is part of how the sperm gets out of the body. And unless you did genetic testing of your recessive markers, you would have never known that. And I probably would have never known it if I wasn't the one who ordered the test and received the reports, because a lot of doctors don't realize if you don't have both genes, they don't think it's a big deal, but it is a big deal. So there's a lot of different things that can impact fertility on the genetic component. And then from a more functional perspective, there's genetic SNPs, so single nucleotide polymorphisms, that can impact fertility as well. For example, some people have MTHFR issues, and that affects your ability to metabolize folate. And an obvious sign that this might be an issue for someone is a high homocysteine. So if you do a blood test and you see homocysteine is elevated in a man above 8 in my books, but really in like the teens or 20s, which was my husband's case, he was the highest homocysteine I've ever seen, it can indicate that there's a genetic SNP issue with methylation. And in methylation, that's one component of how we make DNA. If you can't properly make DNA, then you can't properly make sperm. So hyperhomocysteinemia is an actual risk factor for sperm issues. So that's actually a big screening tool that I use in my comprehensive lab testing on male patients and female patients, because it's indicated in miscarriage in women, to just kind of assess maybe how that factor is working. So that's just one example of a functional kind of genetic SNP that can be impacted a little bit more by lifestyle, but can also be passed down from family members too.
Okay.
And good reminder that even if we do have some kind of genetic predisposition, that maybe it is just that, a predisposition, and that we can do something about it, like with a SNP. And then there's more serious genetic conditions, of course. And I think you kind of touched on this a little bit, Dr. Leah, but how long would you say before conception do we need to start doing this workup and making these changes?
Yeah, so this is one of the most common misconceptions about fertility for men and women, I would say, is that it takes about 3 to 4 months for sperm to go from their tiny little baby seedlings to being fully grown up and ejaculated out of the body. And I think a lot of people, I see this all the time, where people will do like a really intense detox for a month and they like eat really well and they don't drink alcohol, and then they try to get pregnant that month. And that's great. I'm glad you're doing the changes, but his sperm that month was from 2 months ago. And so it's important to remember that any shift or change, technically it's around 75 days, but it can be up to 90. Any shift or change that he makes, it takes about 2 to 3, sometimes 4 months for some people to realize those changes. I just, because it takes so much time and lifestyle changes can take so much time, it's why I'm so passionate about the preconception window of, as soon as you even have an inkling in your eye of wanting to have kids, even if you're just engaged or you just got married, do the testing now. Do the workup as soon as you learn about it, because you only have then more time. There's no downside to knowing this information sooner. If everything is great, that's just peace of mind. And if it's not, you have time to make shifts and changes. The most heartbreaking thing is honestly helping people with infertility, which is so weird and ironic, because I know so much that they could do, yet many of them just aren't willing to take the time, or they're being shuttled, through IVF or whatever. And I have to just sort of like help them be better than maybe they were, when I'm like, if you had just come, a few years earlier, everything could have been different. And it's hard to, I can't say that to the person in front of me because you can't go back in time. Yeah. But I just want to scream as loud as I can to anyone who's in that, earlier stage of their journey. Like, please don't wait. Like, it's just so hard to motivate people who don't have a problem. That's why preventative medicine is challenging, is because people don't have an immediate problem that they are trying to fix. It is like a future thing that could happen. And that's why I'm just such a fan of just check your fertility. Just make it a part of your life. Like, to me, that's the best wedding present you could get anybody, is like a sperm test for the man and a hormone test for a woman, because
I love
it could just change their whole life. I would never wish infertility upon anybody.
Right. And even if they don't want to conceive, it is a marker of health, or the lack thereof, as you said. So such a cool way of thinking about it, and an important way of thinking about it. And now that we're talking about the sperm analysis, can you talk to us about what constitutes a normal sperm count, and has it changed over the years? I know the answer to this, but I would love for you to elaborate, because I heard you talk about it and I just find it extremely valuable and shocking.
Yes. So a good semen analysis is going to look at a few key markers. One of them is count. That's how many sperm there are. One is morphology, which is what the sperm look like. What do their heads look like? What do their tails look like? And then motility is how well they swim. And all three are important. There's other factors, obviously, but those are the three main ones. So all three are important for conception. And in my opinion, all three are important for any conception, including through IVF, because again, if a sperm is showing signs of shape issues or swimming problems, So with a count, let's just start there. Yes, the normal concentration, according to the WHO, is now 15 million, which I know sounds like a lot, but it's not that much. That is, anything below that is considered low. However, these levels were drastically higher just a few decades ago, and they keep moving the normal lower and lower to, I guess, avoid alarming everybody that all these men are infertile. I don't know what their rationale for that is, because instead I think it should be, oh my gosh, all of these men are having fertility issues, but they just keep moving the normal range down. So it used to be just 20 million not that long ago. Now it's 15. But if you look back in just the last mid-century, almost all men today would be considered infertile back then. So the levels are just drastically declining. And from a count issue, if you do a semen analysis, and I actually have a guide about all the different markers of the semen analysis, what's normal and what's optimal, as well as how to do testing at my website. You can go to womanhoodwellness.com/sperm, and I have that all there. But the key thing, and what I think is important for people to know, is if you do a semen analysis and the count is between 5 to 8-ish and 15, you're still considered low count. However, I typically look at that and immediately think this is lifestyle. And for the most part, if we can identify the root cause of that, we can make some really big shifts and changes. If you do a semen analysis and it's under 5 million, that to me is a huge red flag that there's a anatomical issue. That means there could be a varicocele, which is dilation of the veins in the testicles that causes heat and oxidative buildup and even physical blockage of the sperm. Or it could be some of those genetic issues we talked about, or something like the cystic fibrosis mutation where something maybe didn't develop correctly in utero, or there's some other blockage or infection or something very serious is going on to have a count less than 5 million. Like I said, it's still important for those men to optimize their lifestyle because of the small amount of sperm that are there. They need to be healthy, but I wouldn't just let that kind of go and be like, well, maybe I'll just stop sauning and it'll probably get better. It probably won't. There's probably something more serious that needs to be evaluated by an actual fertility doctor. And then from morphology and motility, there's different variations. So like with morphology, again, the normal is like greater than 4%, which it's just like these levels just keep going lower and lower than what they used to be. And I actually see a lot in my patients, way less than 4% morphology, meaning let's say you have 10 million sperm, less than 1% are normal. That's not good, right? That's not good for natural fertility or for IVF. And then motility, you want a greater than, I believe it's 30, it might be 40%. Don't quote me on that. I don't have the numbers in front of me, but so you should have a good majority of your sperm swimming. And a lot of times what I see typically in practice, what I've seen is if there's a low count, low morphology and motility, if we work on some of the lifestyle factors that I mentioned, some of the bigger overarching categories, count definitely improves, motility improves. Morphology is the one that seems to struggle to improve the most in my patients. And I believe that is because toxins, I think, are a bigger factor in morphology than even some of the other markers. And again, it's because morphology is such a marker of the DNA breakdown, which again, I think comes so much from toxin exposure and things like that. But they all interplay and play a role. And, there's certain data and literature that show certain herbs and things support just morphology or just more fertility. But as a general rule, almost all things that support male fertility kind of support all of them.
Okay. Very interesting. Oh, Jen, do you have a question?
Well, I was just, because you Yeah, you mentioned the herbs. That was kind of a nice segue into my thought process, which was, we're definitely going to jump into lab tests. I'm fascinated to talk about that with you, but I'm also curious, is there any other specific modalities or treatment approaches that you find particularly effective with this group of clientele?
Yeah. I think acupuncture is great for both male and female fertility. I think it works on a level of the body and the energetic systems of the body that are just wonderful. So I highly recommend that for people. Red light therapy has some promising results as well for fertility. Obviously, I love herbs, being a naturopathic doctor. So nutrition is first, right? That's the foundation of everything. And there are certain key important nutrients that a man must have to make sperm, to have testosterone and make sperm. Things like zinc and selenium and vitamin E and vitamin C and folate and B12 and all of these key nutrients that are involved in making DNA, making the sperm. If they are not there, the analogy that I give in one of my podcasts, and maybe it was a course of mine, I can't remember, but is that the sperm are in a little swimming academy, right? So imagine the difference between sending your child to a swimming academy to try to become an Olympic swimmer at a rundown place outside of Chernobyl where there's no food and they have to kind of forage for food versus sending your child to like an elite swimming academy where they have the best nutrition, like it's in nature, there's no stress, they're like given positive affirmations all the time. Like just imagine like how different those children's experience would be and who do you think is going to win, the Olympic race. So when you're trying to make optimal swimmers, your sperm, you want to give them all of the nutrition, you want to remove toxins as much as possible. Oh, the other factor that I forgot to mention is EMF exposure. That is probably a factor that a lot of people don't realize. And even some people, which blows my mind, are like, I don't believe in EMFs. And I'm like, this is not a belief. You don't believe in x-rays. It's not like, well, I don't believe in an x-ray, so therefore it doesn't exist. Or I don't believe in like radiation therapy for cancer. There are electromagnetic frequencies all around us. Our microwaves, our, the thing that you walk through at the airport. These are all on the waves of EMFs. Our Wi-Fi, our cell phones, our electronic devices, they all have EMFs as well. And they impact sperm. So having a cell phone in your pocket all of the time, working close to your Wi-Fi, having your laptop on your lap, these are all going to impact sperm. So that's kind of the Chernobyl analogy in our swimming academy. You don't want radiation around your sperm. So yeah, working with all of the key nutrients and that support, and then herbs, it would be again, like giving the little swimmers in your academy protein shakes and all of these like key nutrients to help them be optimal for swimming. Is it essential? Like, did our body evolve to like need herbs like it does certain vitamins and minerals? No, but they definitely help to support. So there's a lot of key herbs like shilajit and ashwagandha and tribulus terrestris and all of these other herbs that are really, really wonderful for male fertility. So I know you didn't ask about all the things, but I just wanted to throw that out there of what kind of treatments. It's multifactorial.
Awesome. And I'm sure our listeners do appreciate that you threw out all the things. Let's talk about your intake process. I always find this curious, and I would imagine the providers that are listening would find this valuable too, because everyone's process is different. What is your intake process? Do you typically do a consultation first? Do you have them fill out a thorough questionnaire? What does that look like for you? And is it different for men versus women?
Yeah. So in my ideal situation, if both partners are on board, some partners come to both appointments, but I like to have a full intake for a female and then a full intake for a male. And then oftentimes, if they're a really supportive couple of each other, they come to each other's appointments and kind of sit in, which is really nice. So they can kind of ping off of each other. But I have both fill out a very extensive intake form. And it involves, asking about all of the things that we do in naturopathic medicine, all the root cause things, as well as some factors that could hint to root causes of fertility problems. Things like toxin exposure, a history of mercury fillings. That's another factor that can impact sperm, or mercury amalgams in the mouth. History of dental issues in general, history of root canals, these kind of things, which can cause inflammation that can affect the microbiome, which can affect sperm. Where they grew up, their profession, are they paving asphalt roads for a living? If that's the case, I'm going to be a lot more concerned than someone who's like a stay-at-home dad in a, farm, even though, okay, you're a farmer, I'm thinking herbicides, pesticides. So just like your profession in general gives a lot of insight into what your exposures could be. All of the lifestyle factors. So a comprehensive intake for both partners, as well as kind of what they've tried, what they've had worked up if they're an infertility patient. And then I typically like to do a timeline with each partner. I don't have them fill out a timeline on their intake form because I like to kind of talk through it, in person and kind of fill in all the pieces, because I discover, because I'm so focused on root cause, that I find a lot of the little nuggets of what could be leading to root cause through that timeline. And a lot of times people don't even remember them until they're being prompted in person. Things like infections that they maybe had traveling in Southeast Asia, or, whatever random things come up that are kind of pings for me as to what could be going on. So I do that intake form, a timeline of their history, go through their lifestyle, talk about those kind of things, and then evaluate what labs they've already had done. My favorite patients are ones who've had nothing. So then I can kind of direct them onto like all of the different things that I like. If they've had labs, that's great. It's just typically I'm going through a lot of labs from the conventional model that they think they've had a lot of labs done. So they're maybe less open to doing more. Yet when you look at them, it's like a CEMP and a CBC and a infectious disease panel, and it's not that helpful. But we'll go through whatever they've had done. And then I decide typically at that point what additional investigation I want to see with labs based on whatever root causes we found. If I think microbiome is a bigger factor, maybe stool testing. If I typically do a full comprehensive blood panel on both partners. If I think toxins are more of a factor, maybe going down that path. So it just depends on kind of what I find as to what testing I do, and then evaluating the person in front of me as to how overwhelmed they feel, how much I need to hold their hand. Do we need to take this very slow and take it one step at a time, or are they like throw it at me? And I always check in with my patients on their overwhelm and also their cost, ability, and also how motivated one or the other partner is. Like if I suspect mold, I maybe won't make both partners do a mold test. I say, let's start with, you, and we'll see if you have mycotoxins. And if so, then maybe we'll either test your home or test your partner. I don't just throw everything at every person, because that's, that can be crazy. So it's a case by case basis on what feels good.
Gotcha.
Yeah,
Great.
fair. You got to kind of be judicious in choosing the labs, but also use them because it gives so much great information. And I never really thought about it in terms of a couple, but that's so interesting. It's kind of, okay, well, if it's toxins and they live together and they pretty much have the same exposures, of course, in the past, it might be different, but I think that's a really nice workaround.
Yeah.
So,
and sometimes we do identify it where I will end up have both couples run tests, and it kind of puts more of the puzzle piece together of, I had a couple last year and we ran mold mycotoxins on her and they were really high and they were stachybotrys, which is a big deal. It's a really bad one. And so in my mind, I'm like, okay, well, do you have stachybotrys in the house? Because that's a big problem. We ran it on him. He doesn't have stachybotrys. It doesn't rule it out completely that it's not in their home. But it could have been from a past exposure that she had, and all of these different factors. So it also tells me like how alarming we need to be at, even addressing their current environment. Just using labs is another part of that puzzle. And I always tell patients, I love labs. I would run all the labs if I could. I love data. And so a lot of people feel similarly, and some people, move through what they can, and I will prioritize what's most important.
Yeah,
sure. And so you kind of just shared a case, Dr. Leah, but I'm wondering, is there another case that comes to mind wherein labs helped you tailor and successfully monitor a fertility plan?
Oh, I mean, labs are key for everything. I mean, just an example, I mentioned I do comprehensive testing typically on both partners, on females and males, and we could go into females like on a whole other section, but let's talk about males. So, for example, like running a comprehensive, I do the Vibrant comprehensive. I have a male panel that I've created, and looking at things like testosterone, FSH, LH, prolactin, estradiol, homocysteine, HSCRP, which tells me about inflammation, just cholesterol in general to kind of tell me, is this in a really inflamed person? How's their liver doing? Their liver enzymes. I get a lot from this comprehensive panel. And if anyone wants to know what I typically check. I do have a free guide as well on my website or my Instagram, Dr. Leah Gordon. I run almost the exact same panel on men and women, just slightly different. Men, I don't run progesterone and things like that. As just a kind of basic look at what's going on. Let's say an HSCRP comes up positive, then I'm typically going to do like a stool test to look at the microbiome. If high homocysteine comes up, or I suspect in their history a high toxin exposure, I'll run the toxic panel from Vibrant. And through changing certain things, starting on supplementation, like let's say it's high homocysteine, getting them on a really good methylated comprehensive multivitamin. If testosterone is low, really supporting and boosting with key nutrients like the zinc and the herbs that I mentioned, shifting their lifestyle, getting them sleeping, eating better, maybe looking at their micronutrient panels. So looking at key nutrients that are low, boosting those with omegas and all of the different nutrients like I mentioned. And then toxins, I typically start with people reducing their exposure in their personal care products. That seems to be a good place for people to start, even though it goes much further than that. And honestly, the majority of toxins that affect sperm are probably coming from the home, new furniture, new flooring, paint. So anyone who's done a recent renovation is always a big flag for me. I had a patient just, his poor sperm, and they're like, oh yeah, we just put new vinyl flooring in our house. Maybe that's why my phthalates are so high. His phthalates were off the chart. And that's really tricky because unless they move, that exposure is not going away anytime soon. And like, these are like the unfortunate things that we have to deal with in the modern world that are honestly really depressing to me, because personal care products are great. And I don't say this to depress anybody, but it's the reality of fertility and of being a clinician, where we always start with the stuff we can control. And some things are a little less in our control, new turf in the backyard. And these all have phthalates, which greatly impact sperm. So I just want to encourage anyone who's listening, both a patient or a provider, to assess the environment that the person lives in as well, not only for mold and things like that, but new products. Encourage your patients, if they buy new furniture, to go low tox, buy solid wood things. Particle board, any furniture that's made out of particle board has tons of toxins in the glue that hold it together. And these are the kind of things that I don't get into on the first few visits because it really overwhelms people. But as a provider, if you're confused as to like, I don't know, they have really clean shampoo, I don't understand why their sperm is still bad, like really evaluating their environment is key, because phthalates have a fast half-life. They should be out of the body pretty quickly. And if they're sweating, phthalates leave out of sweat pretty rapidly. They're pretty water soluble and leave pretty quickly. So if a person is detoxing, taking glutathione, sweating, doing all of those things, and they still have phthalates, definitely look at the environment that they're in. Yeah, but that's just like one example of, we do the best we can, right? And then we support as best we can as providers, and we help. We can't like magically make the world exactly different, but like in my life and my choices, we're very conscious about what we choose, including our furniture and paint and things like that. So just educating patients that they do have options, even in those big decisions. It's just a lot of people don't know that they impact.
Absolutely. Yeah. And then just curious, Dr. Leah, with that case where they're renovating the home, how did that pan out? Did you do repeat testing?
Yes.
How long did it take for those to go down? You said it's pretty fast with the phthalate.
Yeah. So again, with a renovation project, it's tricky getting in like the HEPA filters and things like that. In that case, his phthalates still were quite elevated even on repeat testing because he was living in this newly renovated home. But his markers in general improved, his sperm got a little bit better, but it wasn't night and day. It wasn't like a magic fairy, came and like everything was better for his case, because he was just living every day and like this off gassing of tons and tons and tons of phthalates all around him. And so that was kind of a more depressing case. They actually are in the process of going through IVF now, which is unfortunate, that it has come to that. But hopefully there are ways that they can spin down his sperm and pick out higher quality ones. And this is just a specific case. It's not always like this. A lot of times there can be some really amazing shifts just from the lifestyle stuff alone. I mean, we see sperm levels like double with just changing someone's diet sometimes. It's just like I said, for not everybody, that's the case. And so I'm speaking to the people that have more complex cases where it's like, well, why isn't this shifting? Why isn't it getting better? I've repeated, I've done all the things. He's taking glutathione. Why isn't it better? And, like I said, it's typically that there's some persistent exposure that they are unaware of or aware of, but can't do anything about.
Right. And as long as we can assess that and make people aware, knowledge is power. So it sounds like you're doing all the things and troubleshooting all the different ways. So treating that individual and really looking at that. And I think that's what's important. So
and cool. Just I want to say, sperm are very much influenced easily by their environment, both positive and negative. So I don't want to end on like a depressing note in the sense that there is so much that we can do to impact male fertility. Sperm are very receptive to whatever you put around it. So I want people to know that there's so many amazing positive responses and experiences that happen. And it's just, I just want people to know that they are very easily influenced, both positive and negative. So focusing on the positive is well worth your time.
Absolutely. Works both ways.
Mm-hmm. That's right.
Great. Well, we could keep going, Dr. Leah, and it's been so wonderful. I've learned so much, so I know that our listeners have appreciated it as well. Before we wrap it up, I just want to review and thank you for being here again. We've talked about male factor infertility and all the different factors that can impact that, everything from diet, lifestyle, alcohol, overheating, toxins, the microbiome, etc., and all the empowering things that we can do to really revamp somebody's lifestyle and make big positive changes. So thank you so much for broaching a topic that is not talked about enough. And before we set you free, we'd love to learn about you a little bit more on a personal level. Do you want to engage in our 3 rapid fire questions segment?
Sure.
Great. Okay, I'm going to do the first one. What does your ideal date night look like?
Ooh, ideal date night. I would say it is getting dressed up, not like super fancy, but somewhat fancy because I'm very feminine essence for anyone who knows about those things. And my husband taking me to a really fancy and healthy restaurant and having really good food. In my dream world, if I could be a wizard, I would be able to eat gluten and dairy. And I would be able to eat whatever I want at this amazing healthy restaurant, have a nice, like, fun gin cocktail, and then go into nature, like walk on the beach or go to a park or something and just like be together in nature and hang out after a wonderful meal. I love food.
Me too.
And I'm with you on the gluten thing. Yes, if I could go back and eat I don't know if they make healthy donuts, but that's one of the things I miss the most.
Exactly.
But speaking of donuts, what is a guilty pleasure for you?
So I have oscillated times in my life eating gluten again and thinking, can I do this? So like postpartum after I had my daughter, I was just like, whatever, I'm going to eat whatever I want. I'm starving to death from breastfeeding. So I actually did get some really good donuts around here, but I would say on like a healthy guilty pleasure, I just love cookies. I love chocolate chip cookies. So finding a good like gluten-free chocolate chip cookie is a joy of mine. Or if I could eat like a regular one, that's awesome. And then, for just like a fun snack, I just love chocolate and peanut butter. They're just my favorite. I love that combination.
Dip it right in the jar.
Yep, exactly.
Good choice. Good choice. All right. And for the last question, if you could travel back in time, when and where would you go?
Like in time and like the whole of the world, or just in my life?
The whole of the world.
Okay. I would probably go to Greece at their prime time when there was like all of the Greek philosophers and, have their wine and talk to philosophers and go to their baths and do all of the like amazing things that I feel like the Greeks
Parties,
were so dialed in. Yeah. Find out if the Greek gods and goddesses were actually real and they were aliens or something. I just like really want to know. So I'd probably go to Greece. I'm really fascinated by that time period of like back in the day, you know, when we
I
traditionally
love it.
think of Greece.
Me too. I love the mythology.
Yes, same.
I bet it would.
So fun.
That would be absolutely fascinating to experience for sure.
I agree.
Awesome. Well, I've had a blast. Thank you so much, Dr. Leah, for your insights, your expertise, sharing your own, vulnerable story. I know it's resonated with us and our listeners, I'm sure. So let everyone know, you mentioned your website a few times, but let them know where they can find you, both your website, maybe your social platforms.
Yeah. So I'm on Instagram primarily at Dr. Leah Gordon, no punctuation, just Dr. Leah Gordon. And then my website is womanhoodwellness.com. I have a ton of resources, womanhoodwellness.com/free or womanhoodwellness.com/sperm. You can find all of that information there. And then for any females listening, I have a free fertility type quiz, which tells you one of 12 types of fertility types. And I have amazing tips depending on your unique type. So you should check that out. It's also at my website and on my social.
Awesome. Fabulous. Well, thank you again for being here. And to our listeners, thanks for tuning in. Until next time, stay vibrant. Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness Podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.